Most horrific, frightening thing you ever endure in your life. But the fear is like somebody's torturing you.
Until it actually hits you, you don't realise it's happening to you. You do end up struggling to breathe a lot. It's like as if it's your last air.
This is a life-threatening disease, and every one of us is at risk of death.
Ealing Hospital in West London, a small district general. Ward after ward after ward filled to the brim with COVID patients. This was Elizabeth Cook on the day she tested positive. This was her as she lay in the high dependency unit, one step away from intensive care.
I actually thought I was going to die. I came to that point and I thought, this is it. I'm not going to get better, because you see the route, you go from the COVID ward into here, and you know in your head you're thinking, am I going into ICU? And that fear.
There are 10 medical wards here, 8 of them are now COVID.
And spend a lot of time talking to them and reassuring them and explaining that the mask will be tight and they can't feel any air going in, and we are going to strap it down very tightly, and they might feel like they're suffocating, and a lot of reassurance about the patients around them that are equally as sick that they are looking at, and they're fully aware of what's going on the ward around them.
And indeed, as she returned to her bay, a patient in the bed next to Elizabeth had died. We didn't film it, but we saw her having to be comforted by the staff. Last night we learned that the new variant may be slightly more deadly than in the first wave, but this is looking at everyone who has tested positive. Because of new and better treatments, the chances of dying in hospital are now actually lower.
So they are coming more breathless, struggling to breathe. Their saturations are quite low. We've had quite a few fit and young people who had severe COVID pneumonitis, as we call it, like their x-rays were full of COVID and requiring quite a lot of intensive support to get better.
Ealing serves a population with high-density housing and a large South Asian community, and it's reflected here on the wards.
A lot of our patients work in Heathrow Airport and close proximity to each other. There is a lot of house sharing, and there are a lot of joint families in BME community, and that puts them at much higher risk than anyone else.
Like Shaminda Mahimbru, who's been here since the 2nd of January. He works in customer services at the airport.
So you've got people in front of you all the time, and people coming in from abroad.
Exactly, coming in abroad, and they don't have they don't have proper checks even. I've noticed that they don't have proper checks. This all should have been since March when it first started out. They should have actually put a stop to people coming in.
The comfort of tea, it's needed. This is a week that's knocked the staff. They thought it was bad in the first wave. They thought it was bad as the second wave started.
Are you all right, sir?
But now they realise this is what bad looks like. 180 patients with COVID, and this is a small hospital. A&E, the emergency department. If you want to think of it like a pyramid, this is the base.
Or the red phone's going, another blue light respiratory, where are we going to put them? And these are young people coming in who are going to die unless you do something very quickly. None of us have ever been prepared for that.
It's just non-stop coming through the doors.
Even today?
Even today. We have patients waiting to coming in, blue lights coming in constantly, so it's non-stop really. Our nurses are working in and out with the doctors, in and out, day and night.
And this is the tip of that pyramid, the intensive care unit. They only have 10 beds here, and as we arrived, a team had come to take a patient to St Thomas's Hospital's ICU, the very one the Prime Minister himself was in last April.
We have other patients who are potentially going to deteriorate out on the wards. We've needed to make some capacity by asking neighbouring hospitals to transfer patients out.
There was only one patient on this unit who was conscious. All the others were in comas and ventilated. He was terrified.
What we're finding is that as soon as we get a bit of breathing space, as soon as we get a bit of capacity, we're needing to admit somebody else. And I've seen it described in other reports as soon as, the beds aren't even getting cold because we're moving people in. And if people, there's no time to really think about patients who've passed on from this illness, because you're on to the next patient who needs our help.
This is a virus that defies expectation. A patient can seem to be improving and then will suddenly deteriorate. And for the exhausted staff, this requires vigilance and speed, and now more than ever, the most incredible stamina.
Well, senior doctors have voiced concern about the UK's decision to delay giving people the second dose of the Pfizer vaccine. The British Medical Association said it was worried that leaving a long gap between doses could reduce its effectiveness. Fatima Manji is in the newsroom with more. Fatima.
Yes, Kathy, that vaccination programme is being rolled out speedily, and it's something the UK government is very proud of. Official figures show 10% of the adult population has now received a first dose of the vaccine. And places of worship, such as mosques, are being used as vaccination centres. The Secretary of State for Communities, Robert Jenrick, was visiting a mosque in Birmingham today. Now, the UK strategy is to give as many people as possible a first dose of the vaccine, and that means delaying people getting the second dose. Now, that's a strategy that's causing some concern from senior doctors. The BMA says that they are worried that the Pfizer vaccine test is based on giving doses 3 weeks apart, whereas the UK is giving these two jabs 12 weeks apart. And they're worried that that will affect the vaccine's efficacy. They've written to the chief medical officer in England, noting an absence of international support for the UK approach, and they're calling for an urgent review. Now, for now, health officials are defending the UK approach, saying it's best for public health. The other thing worth pointing out, I spoke to the chair of the BMA a little earlier, and he says we need more evidence and transparency. By now, we should have data from people who have been vaccinated 3 weeks ago. Have any of them got COVID? Have any of them been hospitalised with COVID? And if they have, we need to get that data to see how effective that first dose alone is.